It is time to start thinking about these systems as broken. We need to stop trying to save them and start trying to figure out why they're not working and solving those issues. However, I believe the NHS is a broken system and it should be privatized. But at the same time, when I say the NHS should be privatized, I still believe there should be a national health scheme, which would be an insurance-based system which ensured the entire population of the country received the best possible healthcare the country can afford. And I'll break it down what I believe, just so you can understand. Implementation of a government-funded insurance system should exist in tandem with private medical services. Under this system, citizens would be guaranteed limited coverage by the government. People would have the option to seek treatment from private providers within the allocation of their personally managed scheme. This balance between public and private healthcare would lead to a more efficient and cost-effective system overall. To ensure citizens prioritize their health and take personal responsibility, healthcare insurance coverage should be capped at a certain amount. Allocations for doctors, health screenings, optometry, dentistry, and prescriptions would all be provided each year, with a non-capped carryover system in place, as protection for those years when health is just not at optimal levels. The system would incentivize individuals to manage their health by offering bonuses and perks for healthy behavior. Private companies would be responsible for managing doctors' practices and hospitals, and this would ensure maximum efficiency of these services as they would be paid per patient seen. It is time to stop penalizing the entire country for the few people who can't look after themselves. Everyone gets sick eventually. However, the current system does not look after those who really need it, as it is filled with hypochondriacs and self-harmers and those who don't look after their bodies. So as we look into the NHS funding, it is clear from this slide here, right, let's look into NHS funding. 22% of the country's money goes on the NHS. That means there's 22% of every single receipt that the country has goes on the NHS. The budget for the NHS is 230 billion. The UK population is 68,772,834. At the time I'd got the data. That means the cost per citizen is £3,344 and some change. That's how much each person in the country would contribute to the NHS. Nationally, GPs are paid on average £155.46 per registered patient. That means, of that 230 billion, 10.6 billion or 10.7 billion goes to GPs. I believe this is a substandard service provided by the GPs, and I believe it could be better. On average, in the UK, any member of the UK population goes to the doctor 7 times a year. Now, just stop and think about that for 1 minute. When was the last time you went to the doctor? Last month? Last year? How many times do you go to the doctor a year? And in the last 10 years, how many times have you been to the doctor? I'll start. I have been to the doctor 7 times. That means somebody else or some other people have used my other visits. If on average we're going to the doctor 7 times a year, that equates to 481 million appointments. For argument's sake, imagine the GPs in the UK were private. At £50 a consultation, GPs would take 24 billion. That is the true cost to deliver the service I believe we should all be getting. GPs are underpaid for the work they do. But at the same time, the UK population are not taking ownership for their own health because it's far too easy to just go to the doctor. Because there's no cap, there's no allocation, it's just unlimited. Now, what if the NHS was privatized and the government had a scheme And let's say you could go to the doctor 3 times a year. I still think 3 times a year is a reasonable amount. That would then essentially cost the country 10.3 billion, which is almost 400 million cheaper than they currently pay now. But the service would be at private doctors' standards. And this is why I'm talking about privatizing the NHS. This is why I believe the privatization would improve the services within our country, but still having a national health scheme, which means all the private doctors are still paid by a government-controlled insurance, which means they can go in and set the prices at a fair exchange. And with the statistics they have, they can calculate exactly how much they can afford each year. As I dig into the NHS, I'm continuously hit in the face by massive inadequacies. And you see these inadequacies only in government-run institutions. You look at the communist countries like Russia and China, this is the level of bureaucratic failure you only see in socialist communist countries. The NHS is losing money up to 7.6 billion a year on stupid stuff. 300 million on hospital administration. 432 million on management consultant. 1 billion on doctors not following the NICE standards. Unjustified price hikes in medication, 1 billion. Paying over the odds for simple consumables like toilet roll and latex gloves, 2 billion. And most recently, wasting 40 billion a year on diversity staff. That's enough for an extra 1,200 nurses. Remember, every dead pensioner is one less pensioner to pay. And I truly believe the NHS and the government are not doing their best for the pensioners and are overlooking the statistics because it's convenient. It's good for the books. That might be incorrect. That's just a deduction I've made. That's my own personal opinion. I believe the NHS and the government are overlooking these failures, especially with our elderly, because it balances the books. And that's why I believe the implementation of a national health scheme would be a much more beneficial way to manage our country's medical needs. Imagine if each citizen got £150 worth of doctor's visits a year, but that £150 would carry over every year they don't use it. So the first year you would have 150. If you look after your health and you don't go to the doctor, the next year you've got 300. And then by the time when you get to 6th year, you really need to go to the doctor more often because you have actual ailments and actual issues. You have a huge amount of money. But by ensuring people prioritize their health and restricting the amount they can go to the doctor, it make people think twice about just going to the doctor. And by having people's prescriptions controlled out of their pot, will make people think twice about going, yeah, I'll take that medication. Yeah, I don't really need it. I'll just take it. It doesn't cost me anything. Or £7 in the shop. I don't care. £7 is nothing. Or when you're retired, it's free. Or if you live in Scotland, it's free. Imagine it came out of your allocation every year and you just saw your allocation coming down because you were wasting money. There's loads of ways we can change the way the country runs its health system. And by doing these changes, we can save the country a lot of money. And at the same time, we can force people to take ownership of their lives. And secondly, we can ensure that the system works more effectively, more cost effectively. We need to stop penalizing the entire country for a few people that can't look after themselves. We need to make sure that the service is there at a set standard for every single individual in the country, whether you earn 1 million a year or whether you're on benefits. Everybody in the country should be entitled to a set minimum amount of coverage. And that should be dictated by the amount the country produces. We should always set it to a percentage of our domestic receipts. And that is the most fair and the only way we can run a system in a cost-effective manner that ensures there is always something there for every man, woman, child of this country.